No one wants to be stuck with a needle, especially many times. This just causes pain and stress. There are lots of reasons why placing an IV in can be very hard. When this happens, this is a condition called difficult vascular access, or DVA. It can be because of diabetes, older age, obesity, chemotherapy, or just because a patient is dehydrated and doesn't have enough fluid in their veins. If you or your family member has DVA, your doctor may suggest a more comfortable alternative that is needle-free. This option is known as the Macy Catheter. It was invented by a nurse to make giving fluids and medications less painful and make the patient feel better more quickly. The Macy Catheter is a small, soft tube inserted just into your rectum or butt. The catheter is smaller and softer than most formed stool or poop. It's a comfortable procedure that takes less than 3 minutes. Water can be given quickly through the catheter and gets absorbed much like drinking water does. Using the Macy Catheter helps nurses and doctors avoid repeated IV sticks, or even more invasive options such as a central venous catheter or an intraosseous needle that goes into the bone. A central venous catheter, or CVC, is a long IV that is placed in a large vein in the upper arm, neck, chest, or sometimes groin. The end of the IV, where the fluid comes out, is close to the heart. An intraosseous or IO infusion gets fluid into the patient's body by putting the needle into the bone by a powered device. Insertion of the needle into the bone feels the same as getting a large IV, but the infusing liquid can hurt. So often, a numbing medicine is added at first to make it hurt less. These two options are usually not attempted unless the doctor decides that a patient is getting very sick and needs fluids or medications very quickly, or they have tried many times to get an IV. If you or your doctor decide the Macy Catheter is the right option for you, your nurse can privately place the small catheter in a quick and comfortable procedure. The nurse begins by putting lubricant on the end of the catheter. Then it can be easily placed in the rectum. A small balloon about the size of a quarter is then filled with water. This keeps the catheter securely in place and keeps fluid or medicine inside your body so it can be absorbed. The other end of the catheter is taped to the upper leg, where fluids and medications can be given without uncovering the patient. And once your doctor or nurse is sure you don't need the Macy Catheter anymore, taking the catheter out is just as simple and painless. You have options if you have difficult venous access. This video should help you understand a little more about what your options are, so together with your care team, you can choose the best one for you.